Well, good afternoon, everyone. Welcome to our eighth webinar now for the year, the series. This is our Ask the Expert Educational Lunch and Learn series. My name is Wendy Farthing. I serve as the Director of Community Integration for MAC Incorporated, the Maryland Living Well Center of Excellence. And I have my co-host here, Ms. Jane Marks. And today we are going to be talking about incontinence and managing bowel elimination. I do want to make an announcement that the meeting will be recorded. All of our previous recordings and resources are housed on the Living Well Center of Excellence website for your use as a resource. And materials are placed there, and you will be able to see that when you register for the following webinars. Next month, I just wanted to make a quick announcement. Falls Prevention Awareness Week is coming up in September. It runs September the 21st through September the 27th. And that is a campaign. It's called From Awareness to Action. And we're going to be joined by Dennis Klima. He's a PTMS, PhD, DPT, and FNAP. And he will be discussing preventing falls in dementia patients. And that will be held on September the 18th from 12:15 to 1. So we hope you are able to join us for that presentation. Today is managing urinary incontinence and bowel elimination, and I'm joined with Jane Marks. She is the lead WEP educator and nurse with the Division of Geriatric Medicine and Gerontology, and she has been the host for all of these sessions thus far. So today we get the privilege of having her present on this topic. So without further ado, we're going to get into it. That's okay. So I want to know, Jane, what does the general term urinary incontinence mean?
Well, welcome everybody. Glad to be here and share some information with you. So if you go to the next slide, Wendy, certainly nobody wants to lose urine, so it is an involuntary loss of urine. And the impact that it may have on our older adults, certainly looking at impact on social activities, people may end up not participating because of they're afraid they may have an accident. In my experience, many people have limited some of the things that they really enjoy because they now are having issues with urine loss that they aren't quite sure what to do. The other issue with urinary incontinence is that it does sometimes create issues with skin integrity as well as hygiene problems. And so in recognizing incontinence is certainly important. And we're going to talk more as we go into it, how it impacts people with dementia as well. But just to start off with, certainly to maintain continence, there are certain functions of our urinary system. If you want to go to the next slide, Wendy. Our bladder, which is shown here, receives urine from the kidneys through the ureters, the tubes that lead from the kidneys. And in order to maintain continence, the bladder has to be able to get the urine from the kidneys and then store the urine. We don't urinate every 10 minutes or so. So the bladder has to be able to accommodate that urine. So it has to be able to stretch to fill. And in order to fill, it has to contain that urine. So at the very base of the bladder, before the urine tube, there is a sphincter that closes that allows the urine to be stored then. And then when we reach a certain amount, usually like 350 or 400 cc's in a normal bladder, we'll get a sensation or an urge to void. And then a message is sent to the bladder to empty, to squeeze that muscle, and the sphincter opens. So there's a lot of coordination from the nervous system. Well, with urinary incontinence, there's sometimes disruption in that we're going to talk about. And then with dementia, there are other things that may contribute as well. And we're going to talk about common types of urinary incontinence in older adults. And I usually categorize them into 4 types. So the first type, oh, I'm sorry. I got ahead of you, Wendy.
Okay. So going into that, what are some common types of urinary incontinence?
So the first type that we see in older adults usually is called stress incontinence, where leakage is usually associated with activities that increase intra-abdominal pressure. So any activity that may press on the tummy area, like bending over or lifting a heavy package or sneezing or coughing. Some of us may be able to relate to that. It is more common in women because it's usually related to childbearing or weakened pelvic floor muscles that help support that bladder structure with the urethra. It usually is a small amount of leakage associated with those activities, but I have seen instances with patients that may have a larger amount, depending on the severity or how full their bladder is. But again, usually small amount of leakage. As I mentioned, it's more prevalent in women. However, we can see it in men. Sometimes men post prostatectomy may have issues with stress incontinence, or sometimes certain medications that may impact that closure that we talked about may cause stress incontinence. The next one is urge incontinence, and we do see urge incontinence in our older population. It usually comes from the fact that for some reason now the detrusor muscle, the bladder muscle contracts when we get to a certain point and we can't hold it back. The urge presents and the person has to urinate almost immediately. So thinking about that as we talk more about patients with dementia, they may not be able to express that they need to go, but it's very little time. And usually with urge incontinence, there is a larger amount of urine leakage. It may be the entire amount that's in the bladder. So it reaches a certain point, and then all of a sudden now that muscle contracts. We do see it more commonly in patients with dementia, as well as people that have had neurological issues may experience urge incontinence. And again, it's that I gotta go, I gotta go. I think you've all seen that commercial on TV where people do describe that phenomena with the need to
Well, wait
void
a
it.
minute. Miss Connie threatened me, one of my other members.
Uh-oh, let's see. Hold on 1 second.
The next type of incontinence that we sometimes see is what we call overflow incontinence. And that's when the person's not able to empty their bladder well. And usually I think of that as two causes. Either one, they have difficulty passing their urine because maybe there's some type of obstruction that's not allowing the urine to get out. And with older men, we sometimes see that with prostate enlargement, where they may not be able to void completely. And sometimes it's hard because you may even think they have a little bit of urge because sometimes they do describe that need to go right away and then they void some, but not enough. Sometimes medicine may cause too tight of the sphincter and may not allow the urine to get out. The other cause of overflow where people don't empty well may be due to any kind of neurological, like stroke or some of the other neurological conditions in which that bladder muscle is not being stimulated by the nerves to squeeze. Diabetics sometimes experience this and therefore don't empty as well. And so again, that needs to be evaluated and appropriate action taken with them. Women sometimes may have issues where the bladder has kind of shifted and now is not in proper alignment. And so they may void some, which is kind of at the top part, but the bottom part that may have dropped may not empty as well as also. And lastly, I want to just talk about functional incontinence. And functional incontinence comes into play in two areas. One, either because there's difficulty with mobility or functionally getting or using the bathroom. You know, sometimes if someone has bad arthritis, they may find it takes them longer to get to the bathroom. They may not be able to position comfortably on the commode. So those things can certainly become an issue. Can you have functional incontinence with stress incontinence? Sure. Can you have stress and urge incontinence? Absolutely. And add functional to that as well. And then the other that we're going to talk a little bit more about is cognitive issues that create functional incontinence. And again, in people with dementia, it may be that we're going to discuss that they just don't recognize the need to go, or they get that urge to go, but not sure what to do. And I think of a scenario that I was referred to a caregiver to talk with who was so good about getting his wife into the bathroom to urinate. And she would come out and sit in the chair, the kitchen chair, and then she would void. And so we're trying to decipher what was going on, thinking, well, maybe she's not emptying her bladder. But what we came up with was he had been taking her into the bathroom, but not observing what she did once he left her. And so what was happening is her dementia had progressed, that she didn't know what to do once he left. She didn't know to sit on the commode, pull down her clothes, etc. And we'll talk more about that.
So on that note, what about a person with dementia and urinary incontinence?
So, as we see patients and as they continue their journey with dementia, we may see issues with urinary incontinence that we need to address. And that certainly is appropriate. And it may become more prevalent as their disease progresses. And so understanding how we can better, assess them, talk with our care providers, and come up with an appropriate treatment plan with that. So I think the first thing, or the important thing, is when we're caring for someone with dementia that may have issues with incontinence, is to know, and you can look at the next slide, Wendy, is to know, have they had trouble with urinary leakage maybe prior to their diagnosis? If so, what were their symptoms? Or did their symptoms just kind of start as their disease progressed? I think knowing a little bit about that. And then what symptoms are you noticing? Are they recognizing the urge or not recognizing it? And we'll talk a little bit about sometimes looking at behaviors and how that may come into play. And what about their bowel elimination? I always think of the urine and the bowel elimination together, because sometimes the bowel elimination schedule can impact urinary incontinence. And you probably may ask why, but if they're having issues with constipation, the stool may push on the bladder, so the bladder may not be able to fill as well. And it may actually enhance the urge a little bit. So we want to know a little bit about what their normal schedule is, how often do they have trouble, etc. Some of the other things to incorporate is clothing. How can we help promote that person to use the bathroom? And so certainly as their disease progresses, let's make it easier for them. It may become harder to do buttons and zippers. We may need to think about looking at elastic waist things so that they can get their clothing down much easier and still maintain some independence with toileting. Ladies may find that skirts or dresses or shifts or something like that may be easier for them versus pants. Or again, if so, using pants, with elastic waist. The other thing to help with incontinence with someone with dementia is looking at positioning. So our next slide talks about looking at positioning. Oh, I'm sorry, I skipped one. So we may not know what they do when the urge presents. Sometimes it's not that they tell you they have to go, but the fact that they may exhibit a behavior. And I think of several patients that we've cared for over the years, that one in particular started tapping her foot when the urge presented. You may see one's behavior become, accelerated, and it's because they have an urge to go, but they're not sure what to do about that urge. The other one may seem more like agitated but pacing. So it may be that there are little symptoms that you can pick up on that are indicating they may need to use the bathroom. And then the next slide is what I was getting at, talks a little bit about positioning. And so certainly promoting comfort is important. You know, helping them get to the commode, helping them, ladies tend, sit down when they void, men tend to prefer to stand. And as long as they're able to do that safely, that's important. Certainly looking at devices that may help them with that, such as assistive devices like side rails or grab bar or something. With men, you may find at night using a urinal at the side of the bed where they can stand. With women, again, using the commode, but it may be that you need some adaptive equipment for that. And they do make female urinals that are available at the store. So if someone has bad arthritis or at nighttime don't feel comfortable in walking to the bathroom but need to urinate, it's actually a female urinal may work well with them sitting on the edge of the bed and using that. So again, to promote toileting positioning. Sometimes too, just putting a little TV tray in front of them to help so that they sit long enough to void. And we'll talk about more about that with the bowel elimination as well. So the next thing to think about with incontinence in someone with dementia is looking to see how helpful a toileting program may help. And I find a scheduled toileting program may be very effective in someone with urinary incontinence, and especially with someone with dementia. And that's taking them on a scheduled voiding time to toilet. So you normally want to take them when they wake up because normally they have that urge to void when they wake up. And then I always recommend you start with an every 2-hour toileting schedule until bedtime. And it may be that they void and they may not void, but certainly looking at ways to help stimulate, such as running the water, allowing that time to try and void. As I mentioned, maybe putting a TV tray in front of them and giving them a little activity to sit for a few minutes to try and empty. If you find that they don't necessarily void every 2 hours, then you may be able to expand the time to every 2.5 or every 3 hours. You can kind of modify it once you work with your loved one in regards to a schedule that will work with them. And certainly that will make it easier too for you as well. Other things to consider with someone with incontinence, certainly in working with them, are any medical histories that may impact urinary function. So for example, if someone's diabetic and all of a sudden now their sugar's higher, you may see that they're voiding more. So know a little bit about what's going on medically that you can then understand a little bit why things may change over time. If they are started on a new medication or their medicines are changed, understanding the impact maybe that has on their bladder function. So for example, if they're on a diuretic and maybe their provider feels they need a higher dose, know that that may impact their continence. They may experience more leakage. And so talking to the provider about that as to how you may adjust that so that perhaps it's not as prevalent or that a little bit less so. I think one thing we need to think about is fluid intake when we're talking about incontinence. And so several things. Most people think, and I will tell you, most of the patients I've dealt with over years don't tend to drink much because they're afraid they're going to have an incontinent episode. I think the challenge that we have with patients with dementia is that getting them to drink can sometimes be a challenge. And I encourage families maybe not offer them that large glass of water, but smaller glasses more frequently. They may not remember that you just gave them a small juice glass of water or something else to drink, but will drink it again. But when you leave that big glass and say, you need to drink this, it may create sometimes some agitation. So smaller glasses more frequently may be better. And the reason I talk about fluids is that, remember, we don't want to restrict because then the urine becomes concentrated and that may act as an irritant to their bladder. Remember, though, there's other ways to get fluid in. So ice cream, puddings, things that they may like to take if they're able to have those in their diet, broth or soups are ways to encourage them to get fluid in, and to then maintain a urine that's, not concentrated. We already talked a little bit about environmental alterations, but sometimes just placing a commode chair over the toilet will help raise the seat that's more comfortable for them to sit on, as well as to give them side rails to like get down as well as get up. Or you may look at other alternatives that they have on the market, like different attachments to the commode chair or side rails that you can actually screw into the wall. Things that work for you are important. But again, it provides a little bit more security and a little bit more comfort to them. And then next, looking at bowel elimination schedule. Most of us have the strongest urge to have an elimination, a bowel movement after breakfast. So how can we encourage that or promote that is important. Being aware of that is certainly helpful. And the next slide, I think, has some more
We're asking
information.
you about that. What are some strategies to promote regular bowel movements?
So, as I mentioned, most people have a normal urge to have a bowel movement after breakfast. So take advantage of that time. Encourage them after breakfast to go sit in and let's relax and try and see if we can. So one of the things that we may want to do is provide some privacy, maybe some warmth, like place a towel over their lap, to give them that warmth. Again, that TV tray so that they can maybe sit. You can maybe give them a little something to do while they're sitting there. You may want to encourage some fluids, certainly during breakfast. One of my suggestions with my caregivers to help promote bowel elimination is after their hot coffee or hot tea or something hot, follow it with a glass of ice water. The warmth tends to seem to relax things, whereas the ice water tends to get the gut contracting. And that may actually help stimulate that urge to then have a bowel movement. If that doesn't seem to work, sometimes just a little glass of warm prune juice followed by the ice water may be quite effective. Or even warm applesauce followed by a glass of ice water may help them naturally get that urge to go. Certainly looking at their diet, we want to encourage things that are high fiber, but remember with fiber, we want to add fluids and we want to gradually add them if they're not used to eating things that are fiber. But certainly fruits and vegetables are important in their diet. The wheat bread versus white bread, the grains, things like that. And again, the fluids to go with it to help keep things moving are important. But remember also, walking or some type of movement is important to help get that gut moving. So encouraging walking is very helpful in promoting bowel elimination. And these are simple things that really should be tried first, that can be quite effective if you get that routine going with your loved one. So again, if they don't have a bowel movement after breakfast, then the next time would be is to try after lunch to see if you can't get that going again, using that meal time in which you would do it. And again, if things don't seem like they're working, then what I encourage you to do is to talk to your provider to see if there's other things that maybe you need to incorporate in his care. And they can guide you then with what would be best for them in regard to their history as well as what you're doing. But I would certainly try these things. I will tell you the hot drink, follow it with the cold ice water seems to work a lot of times with many of the patients that we've cared for.
Well, thank you for this helpful information. Do you have some other tips for managing urinary incontinence, Jane?
Well, certainly looking at management strategies, and again, these are management strategies. There's many things on the market today. And I think as you look at different products, such as pads that are out there, on the next slide, Wendy, you can show some of them. They make things for females now. They make male guards. I don't recommend one over the other. I think you have to figure out what works best for you as to what functional level your loved one is at. So whether it is a pad that you put in their underwear, or whether it's a total garment that's either a pull-up or one that has the straps, you need to do what works best for your loved one, as well as economically, because this is stuff that usually is purchased out of pocket, not insurance often doesn't cover these things. Certainly, if you look at other things, and I don't have pictures of them, but there are male external catheters. The problem that I run into with patients with dementia is that our male patients tend to maybe pull on them and create skin irritation. So again, talking to your provider about that is important. There is not a female external catheter per se. There is a device now that looks like a tube that you can put between the labia, and it's attached to a little suction machine. But again, it's usually for people that don't move around a lot, and I don't think would be quite effective for people that are maybe getting agitated from that. And again, that is not covered by insurance either. So again, protective garments, looking at what works for you as well as your loved one's skin and how they adapt. Some people react to different products because of irritation. So again, it's trial and error as to what you find. I think the most important thing that we can talk about is certainly good skin care. And I will say that after an incontinent episode, it's helpful to make sure that they are given good skin care with just good soap and water. And then looking at maybe some type of skin barrier or cream that you could use. If nothing else, just good old zinc oxide, just to provide that barrier to the skin so that they don't get irritated is important in regards to care. And I think that's probably the information that I have now. Certainly everyone is individualized, and understanding what's going on with your loved one and working with your primary care team is important, so that you can make your care plan more individualized. But again, as dementia progresses, you may need to look at other ways to handle their incontinence. But certainly while they're up and moving, a toileting schedule is, I think, what you could start with, and looking at their fluids and dietary things for bowel elimination.
I think we have some opportunity for some questions. If you'd like to take yourself off mute and ask a question or put something in the chat, we're able to take some questions. I had a question, Jane. Do you have any thoughts on the products that I have out there now, like the little jelly candies that are for fluid for dementia patients? I've seen them on social media type posts, or the new products like the liquid IV, which is it's kind of like a Gatorade for dementia patients.
So I would say I don't know enough about them to make a comment, but I think if you're interested in looking at that, to review it with your provider to see. I think the easiest way is looking at alternative ways you can get fluid in, as well as doing those small frequent things. Certainly, if you notice, one thing we didn't talk about is if you do notice a change in their incontinence, or maybe more agitation, or maybe they're reaching for their perineal area or something, certainly making sure. I think Beth talked about urinary tract infections and delirium last month, but certainly maybe bringing that to the attention of your provider to make sure that there isn't anything in regards to an infection, or especially if they start running a fever, or if you notice they're voiding more frequently than what they ever used to. Those things are important as well. And one thing I didn't mention in hygiene is in women, remember, cleaning front to back is very important. It's so simple, but if you wipe back to front, sometimes you'll bring stool to the women's outlet, urethral outlet, which can cause bacteria. So always make sure in females that you're caring for, if you're having to do some cleaning, please make sure that you do wipe front to back after a bowel movement, or if you're cleaning them, anything like that. All those are just simple strategies, but can be helpful. There are some over-the-counter products too that say for use for incontinence. And again, I would tell you that you need to review anything like that, like skin patches and things with your provider, because sometimes those things can make cognition worse because they have certain medications. So again, looking at those things with your provider is important because that's all individualized. Unfortunately, some of the bladder medicines can impact cognition. So that's why it's important to review things like that with your provider.
Thank you.
Any other questions?
I don't.
Well, you're happy to email me if you do have anything else that you'd like to ask. And I think Wendy has my email, but it's J, the letter J, Marks, MARKS, @jhmi.edu.
And again, we will house this recording along with the slide deck on our website, which you're welcome to access. And we hope you join us next month for falls prevention with Dennis Klima. So thank you for joining us today.
Hope it helps everybody. Thank you.
Thank you.
Take care.